Hey guys, good afternoon. Today, I was not able to lecture uh, this week on joints, so I'm recording here. And this is chapter 9, joints. And in joints, we will go over an overview of the joints, classification of joints, which are three major types: fibrous joints, cartilaginous joints, and synovial joints. And then we will give some example of certain important joints in our body, like knee joint, ankle joint, shoulder joints, and we will talk about them. Okay. So let's start. We will start with a clinical case. A young male soccer player got blow to the lateral side of the right knee while he was tackling the ball. He immediately felt like blown knee with severe knee pain, swelling, and unable to walk. While trying to walk on the knee, he felt like the knee was giving out. Based on these information, what is the diagnosis and pathogenesis of this condition? So while we will go over the structural and functional classification of the joint and the component of a typical synovial joint, then we will go over knee joint and we will discuss this clinical condition with the knee joint. Okay. So by definition, joint is rigid elements of a skeleton which meets at joints, which is also called articulation. The joint, the Greek word for joint is arthros. Okay. That's why when you have inflammation of the joint, we don't call jointitis, we call it arthritis. So articulation or joint are interchangeable terms. You can use joints or articulation, okay? So articulation or joint can be bone to bone. One bone is joined to another bone, or one bone is joined to more than one bones, or more than one bones are joined to one bones, or more than one bones. So any where there is a bone and another bone articulating with each other, that is called joints. Joints can also be between the bone and cartilage, or between the bony socket and your teeth. These all are joints. So joints can be like elbow joint, shoulder joint, knee joint, joint between your teeth and your gum, joint between your sternum and the hyaline cartilage in your chest. These all are joints. Structure of joints. What are the structure of joints and function of joints? So joints enables resistance to crushing, tearing, and other forces. All the structure in the joints, which is made up of joint capsule, bones, hyaline cartilage, other cartilage, the function of these all structure is to enable resistance to crushing, tearing, and other forces which is exerted on our joints. Okay, now classification of joints. Joints can be classified by function or by structure. Let's talk about functional classification first. Based on the amount of movement, a joint can be synarthrosis, amphiarthrosis, or diarthrosis. Synarthrosis is immovable joint, and this kind of joints are common in axial skeleton. That means joint between the skull bones, joint between some facial bones. Those are the synarthrosis, joints between hip bones. And then amphiarthrosis is slightly movable, and that is also common in skeleton joints. For example, your vertebral joints, those are the amphiarthrosis. Now, third class is diarthrosis, which is freely movable joint, and that is commonly found in your appendicular skeleton. That means they are in the upper and lower limbs, and they have joint cavity. Diarthrosis have usually joint cavity, but inside the joint there is cavity. That's why this cavity allows that kind of joint to freely move and produce more movement. Okay, that's why diarthrosis is highly movable joint. Synarthrosis is not movable at all joints, and MP arthrosis is slightly or partially movable joints. Okay. Let's talk about structural classification. You know, structural means what binds the bone. That is the structural classification. So if the bones are joined by cartilage, ligaments, or fibrous connective tissue, based on that, we classify them. Okay. So structural classification based on material that binds the bones together and whether there is presence or absence of joint cavity. So we're going to talk about what material binds the bones together and whether there is joint cavity inside them or not. Based on that, we do a structural classification. Okay. So structural classification include fibrous joint, cartilaginous joint, and synovial joint. Three types: fibrous, cartilaginous, synovial. Look here, fibrous joint, it looks like a fibers, collagenous fibers join the bones. Cartilaginous joint, cartilage is for cartilage. So cartilaginous joint is when bones are joined by cartilage. And synovial joint are bound by synovial membrane and synovial cavity, and which has synovial fluid. That means this kind of synovial joints have joint cavity. That is different from other structural classification. So let's see some examples. Okay. So in fibrous joints, bones are connected by fibrous connective tissue, particularly the thread of collagen fibers. There is no joint cavity, do not have a joint cavity. Most are immovable or slightly movable. So fibrous joint by nature, they are not movable because they have very small collagenous fibers joining them. If there is partial movable, that means the collagen fibers length are slightly longer, and that's why there is slight movement. Okay. So types of fibrous joints are suture, syndesmoses, and gomphoses. Let's see what are they. What are suture, what are syndesmoses, and what are gomphoses. Keep in mind, fibrous joints are joints formed by fibrous connective tissue. These are the material. Fibrous connective tissue is the material which binds two or more than two bones. Let's see now. So first class of fibrous joint was suture. Bones are tightly bound by minimal amount of fibrous tissue. That means between the bones, there are very minimal amount of fibrous tissue, which is common in your skull bones. Only occur between bones of the skull. Allow bone growth so the skull can expand with brain during childhood. So after the child born, their head start getting bigger and bigger and bigger. And this is the joint which expand them. Okay. Fibrous tissue ossifies in middle age, but once our brain is grown after teenage, what happens? Our head does not grow. And in that case, those fibrous tissue in between the bones ossified, becomes the bone, and we call them not suture, rather we call them synostosis. So closed suture is called synostosis. If you see the joint between the skull bones in newborn baby or early child, and in adult, you will find these differences. Okay. Another type of fibrous joint is syndesmoses. Syndesmoses. What are the joining material? Bones are connected exclusively by ligament. So earlier it was collagenous fiber. In fibrous, in suture. In syndesmoses, you have ligaments. Ligaments, which is connecting the bones. Amount of movements depend on length of fibers. If the ligament fiber is small, there will be very little movement. If there is slightly longer, there will be some more movement. For example, tibiofibular joint means joint between tibia and fibula is immobile, and that is called synarthrosis. So syndesmoses can be synarthrosis, means there is no movement at all. But interosseous membrane between your radius and ulna, between radius and ulna, there is a long length of the ligaments, and that is why you can do supine and supine position and prone in supine position of your palm due to this interosseous membrane, and they are freely movable, diarthrosis. Okay. Next type of fibrous joint is, so three types: suture, syndesmosis, and next type is gumposis. So let's see the suture example. In the skull, you see, this is the dense fibrous connective tissue. These are the suture line. Here is syndesmosis, tibio-fibular joint, distal tibio-fibular joint. Now, last type of fibrous joint is gumposis, tooth in socket, bony socket of your mandible or maxilla. So what is connecting here? You see here, this is the bone of the mandible. And then here is teeth fit into it. And that teeth is attached to this bone by another very short length of ligament that is called periodontal ligament. And in the tooth, which you cannot see, which is inside the gum, is called root of the tooth, and whatever is out is crown of the tooth. See? So this is socket of alveolar process and periodontal ligament. So joint between the teeth, between a tooth and the bony socket of mandible or maxilla is called gumposis, tooth in socket. Connecting ligaments, the periodontal ligament is the connecting ligament. Okay. Now, as I says, structure classification in three types: fibrous, cartilaginous, and the synovial. So let's talk about second class, cartilaginous joints. So what are the types of cartilage? If we go back and remember again, there are three types. What are those? Fibers, elastic fiber, collagen fiber, and reticular fiber. Okay. What are the cartilage? Hyaline cartilage, fibrocartilage, and elastic cartilage. So what kind of cartilage joins the bone? Based on that, we can classify the cartilaginous joints. So in cartilaginous joints here, bones are united by cartilage. There is no joint cavity like previous fibrous joint. And there are two types based on what kind of cartilage join them. They are synchondroses and symphyses. So let's see here. Synchondroses means hyaline cartilage unites the bone. You see here, epiphysis and diaphysis is joined at the epiphyseal line or epiphyseal plate or growth plate by hyaline cartilage. So this is synchondroses. Between your sternum and your rib, the joint is hyaline cartilage, so that is synchondroses. But here, synchondroses, but symphyses is the joints joined by fibrocartilage. So fibrocartilage in symphyses unites bones. This kind of joint resists tension and compression. They are slightly movable joints that provide strength with flexibility. So these joints have strength as well as flexibility. And for example, the intervertebral disc between the vertebra is fibrocartilage. So that is cartilaginous joint. Pubic symphysis between two pubic bones of your hip bone is joined interiorly by the fibrocartilage. And pubic symphysis, that's why, is also a kind of cartilaginous joints. So you see, intervertebral disc and the symphysis pubis, both are the symphyses. Hyaline cartilage also present on articular cartilage on the bony surface of articular bones in the symphysis. You remember long bones at the end, they have always hyaline cartilage because that's the remnant, leftover part of cartilage, because long bones develop into cartilage. Okay. Okay, the next structure classification is synovial joint. This is the most movable type of joint, and that's why functionally they all are diarthroses. Each contains a fluid field joint cavity. Only synovial joint has the structural characteristic of joint cavity. So let's see a simplified diagram of a synovial joint. So here is proximal bone, here is distal bone, and between these two bones, there is cavity. See, hyaline cartilage lining, and there is joint cavity. Joint cavity all around the joint is lined by synovial membrane. This synovial membrane filters some blood around here and make this joint cavity fluid called synovial fluid, which is egg white-like fluid. Okay. To make the joint stronger, outside the synovial membrane, you see there is another fibrous connective tissue connecting these two bones. That is called fibrous capsule. So synovial membrane and fibrous capsule together is also called articular capsule. Okay. Outside this articular capsule, to make the joint more stronger, there is another ligament. That is ligament. For example, this ligament is outside the joint capsule, and that is called extracapsular ligament. But let me draw here. Sometimes what happens, some ligaments, like this outside ligament, like this ligament, there are some ligaments which are inside the joint too, joint capsule, and they cross from one bone to another bone. Okay. This kind of ligaments which are inside the joint capsule is called intracapsular ligament. So keep in mind, we have two kinds of joint cavity. I'm going to write it. Okay. Two kinds of joint cavity, ligaments are extracapsular ligament and intracapsular ligament. Inside the synovial fluid, you will find hyaluronic acid, which creates the frictionless movement inside the joint cavity. Okay. Okay. So general structure of synovial joint we talked about. Let's talk about articular cartilage. Articular cartilage are the end cartilage of the bones. End of opposing bones are covered with hyaline cartilage, and that cartilage absorbs compression. Joint cavity is also called synovial cavity, and this is unique to synovial joint. You will not find joint cavity in any other joints. Cavity is a potential space that holds a small amount of synovial fluid. So you see here, it's a joint cavity which contains a small amount of egg white-like fluid. Articular capsule. What two structure forms articular capsule? So articular capsule covers the joint cavity. So joint cavity is enclosed in a two-layered capsule. The inner layer is synovial membrane, and that is made up of loose connective tissue. This lines joint capsule and covers internal joint surface and function to make synovial fluid. So this synovial membrane filters nearby capillaries and filter blood and makes this synovial fluid. Outside synovial membrane, you have fibrous capsule. They are dense, irregular connective tissue, which adds extra strength to the joint. Okay, so which strengthens joint further. And outside this articular capsule, the fibrous capsule, joint capsule, there may be extra ligament, or inside the capsule to reinforce the joint, there may be intracapsular ligament. Hope everybody got what is the joint extracapsular ligament and intracapsular ligament. This diagram is very important for your exam. You're going to see exactly the same diagram and its structure. Okay. Synovial fluid is found inside the joint cavity, which is a viscous fluid similar to raw egg white, and which is a filtrate of blood, and that's why it arises from capillaries in synovial membrane. I talked about it. And it contains glycoprotein molecules that's secreted by the fibrous connective tissue, that is fibroblast, in the fibroconnective tissue. Reinforcing ligament, as I said, reinforcing ligaments can be either extracapsular ligament or intracapsular ligaments. Okay, so reinforcing ligaments often are thickened part of fibrous capsule. Sometimes are extracapsular ligament located outside the capsule, and sometimes they are intracapsular ligament which are located internal to the capsule. That means internal to the synovial membrane. Okay, so let's see here. Again, typical synovial joint. The extracapsular ligament, articular capsule, which is inner synovial membrane, outer fibrous capsule, and then you have articular cartilage, both. This one, which is hyaline cartilage, and you have joint cavity, which contains synovial fluid. Okay, and this is the lateral view of your knee joints. Do you see? Okay, so let's see here. This is a knee joint. Knee joint is the strongest, one of the strongest joint in the body, because this joint bears the weight of our body and we move all the time. So this is femur, and this is the lower end of the femur, which has two condyle, lateral condyle, medial condyle, and these condyles are lined by hyaline cartilage. That's why they look glossy. Then synovial membrane and the joint capsule we have removed so you can see inside. Because the knee joint is a stronger joint, so to reduce the friction, we have a meniscus. See, towards the fibula side, lateral side, we have lateral meniscus, and towards the tibia side, we have medial meniscus. Okay, so let me show you where the capsule is. Joint capsule will be, so you can tell me. So joint capsule will be somewhere here. Here. Okay. So now let's start. So this is joint capsule, and we have two ligaments in the knee joints. One is called anterior cruciate ligament, or ACL. Another is called posterior cruciate ligament, or PCL. They call cruciate because they look like cross of the Jesus cross, and that's why we call them cruciate ligament. Cruciate ligament. And one which is anterior to other is called anterior cruciate ligament, and which is posterior cruciate ligament. So I have a question here. If this is the joint capsule, then ACL and PCL is intracapsular ligament or extracapsular ligament? Answer the question. If this is the blue line I have drawn is the joint capsule, fibrous capsule or joint capsule, ACL and PCL are intracapsular ligament or extracapsular ligament. Okay. To reinforce this joint, there is another fibular collateral ligament and tibial collateral ligament. So when femur is colliding with the tibia, we call them tibial collateral ligament. And when femur is colliding with tibia, we call it fibular collateral ligament. Sometimes we call these ligaments, because fibular collateral ligament is in lateral side of our body in anatomical position, we call it lateral collateral ligament. And tibial collateral ligament is towards the medial side of our body, we call it medial collateral ligament. Okay, so again, to reinforce the knee joint, there are some extra structure like lateral and medial meniscus, the intracapsular ligament, which is posterior cruciate ligament and anterior cruciate ligament, and extracapsular ligament, which is fibular collateral ligament and tibial collateral ligament, and the meniscus. On top of that, to make it further stronger, we will have another ligament like preputial ligament, the biceps femoris ligaments, quadris femoris ligaments, and other muscles. They all act on that. Okay. So let's go now. Let's clear it. Erase it. Okay. So now our clinical case was the young guy who was playing football and soccer, and somebody hit from the lateral side. So impact of hit is here. Somebody hit with the leg here. What will happen? The force will go here, 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 here. So force is transmitting from lateral side. When somebody hits you here, goes all the way here. So what is breaking? Everything is on the way, because this side moves medially. So this has less impact. That's why fibral collateral ligament is not ruptured, but there is tear on the anterior cruciate ligament. There is tear on the tibial collateral ligament, and there is torn medial meniscus. This was the case. So how many things are damaged here? 3 things. Anterior cruciate ligament, torn ACL, torn medial meniscus, and torn medial collateral ligament. This is called terrible triad. And once you have, better you rest for at least 6 months before you do outside game. Okay? And it takes time to heal, and it's very painful. And surgery is long hours of surgery. Okay? This is called terrible triad. So our patient was suffering from terrible triad. Okay, so this is X-ray of the knee joint. You see how this is normal knee joints. This is the lateral epicondyle, medial epicondyle. This is the patella here. And then you have lateral femoral condyle, medial femoral condyle. And then you have a joint cavity. You can see the black joint cavity. So nice. Head of fibula. There is intercondylar eminence of the tibia. So this joint. Now let's see the cartilage here. Normal cartilage. And this side, you see here, the joint cavity here and joint cavity here. So this is like eroding. And there is bone spikes, osteophytes, which is the sign of the osteoarthritis in old people. Okay. So here is the summary of the joint cavity. Now movements. So synovial joints are the highest movable joint, and they are functionally classified as diarthrosis. So movement allowed by synovial joints. I have the YouTube video you can watch here. 3 basic types of movements are gliding, angular, and rotational. So gliding is one bone across the surface of another. They glide, like in the wrist joint or ankle joint. Angular movement, when the angle of the joint is reduced, like your elbow joint, knee joint, hip joints, that. So movement change angle between bones. So rotation movement around one bone's long axis, like your head is moving towards your vertebra, that is rotation. Or you rotate the head of the humerus with your glenoid cavity of the scapula, or you rotate your hip bone. Those are the rotation. Okay. So gliding joint, you see, flat surface of 2 bones slip across, and glide occurs between carpal articular process of vertebra and tarsals. Angular movement, you see, angular movement at the neck, flexion, extension, and hyperextension. Flexion is reducing the angle. Extension is increasing the ankle. And if you increase more than anatomical position, then that is called hyperextension. Extension and flexion at the hip joint. You see, it's a flexion, bending straight. If you come back straight, that is extension. And when you are more extended than anatomical position, that is hyperextension. Here in the knee, flexion, extension, flexion, extension. Here is abduction and adduction. Abduction is when you pull your hand away from your body in an anatomical position. That is abduction. And when you bring back to the joint, that means you are adding to the joint. That is called adduction. Circumduction is when you rotate your palm around, and that is circumduction. Rotation involves turning movement of bone around its long axis, the only movement allowed between atlas and axis vertebra. That is the rotation. That also the in the axis, that is in the between the vertebra, particularly the atlas and the axis. So atlas is your first vertebra, axis is your second, and the movement between them are rotation in axial skeleton. But in appendicular skeleton, like your hip and shoulder joint, has also rotation. This is the special movement of pronation and supination. So in anatomical position, when your palm is facing forward, that is called supination. So when you ask for soup, give me the soup, that is supination position. And when you go opposite of that, that is called prone position. So if you are lying flat on the bed, that means you are facing you upward, you are in prone position, supine position. And when your face is down, then you are prone position. Okay. This is inversion or eversion. Inversion is when you are showing your shoulder towards medial, and when you are doing just opposite of that, that means you are showing your shoulder outside, that is eversion. So inversion and eversion. Elevation, depression, lifting a body superiorly, like your mandible. When you close your mouth, that is elevation. When you open your mouth, that is depression. Opposition is movement of thumb to touch the tips of the fingers. So like when you're counting 1, 2, 3, 4, 5, that is opposition movement. And dorsiflexion and plantar flexion is in anatomical position. When you are pointing your toe towards your nose, that is dorsiflexion. And when you are tiptoeing, pointing your toe towards the ground, that is plantar flexion. So these are the movement and joint lecture. Thank you, guys.